Yes, I have lots of patients on, statins, for instance, blood pressure medicine, diabetic medicine, antidepressants that are able to get off all of their medicine. If they've been a diabetic for a long time, I have one patient that he's off all his insulin and he was on 2 oral glycemic medicines. Now he's just down to 1. So depending on the duration, maybe we can't get you off all of certain medicines, but I have many patients that have been able to reduce or completely eliminate their other medicines. I'm Teresa Mealy. I'm a family nurse practitioner in Springfield, Missouri. We have a lot of women, usually about 40 and up, and typically they come first, and about 6 weeks later they bring their husbands in. Improvement in mood, mainly sleep, things just progress naturally, like weight loss, exercise gets better, then weight improves more and mood improves more because now you're exercising more, you're making better food choices, libido goes up. All these things really just at a foundational level makes their life much better.